Everyone, this is our stretch mark and camouflage video. This is our client before the treatment. So this is me starting the treatment on our client. When she came to me, her stretch marks were quite deep in the skin. So I recommended that she had a treatment of skin needling, which will bring the stretch marks up from the surface after they've healed. So then we've got a flatter surface to work on when we're camouflaging the colour on. So I'm just working my way across the skin. All this does is, once it's healed, pops the stretch marks up to the top, like I was saying. So I'm kind of trying to explain to the client at this point what we're doing. I've tried to fast forward up this video a little bit because it ends up way too long. I wanted to put this whole video together so you got to see step by step. So this is after. It does look a little bit gory, but trust me, it's well worth it. So that I'm trying to show you all the way around the body. And it does take a few weeks to heal. And we have to wait for the skin to not be any pink anymore. So this is before and after, or before and straight after. So this is 5 days after the treatment, showing you how it scabs. The scabs form on the top, and then the top layer of skin kind of crusts off the top. And then once it's healed, the stretch marks move to the top and it's a lot flatter, so we can get the camouflage pigment in better. So it really depends how your skin takes to this, whether you need 1 or 2 of these treatments beforehand. But some people go straight in with the camouflage if they don't need to pull the stretch marks up. So this is before, straight after, and the healing process. And this is it healed after that treatment. It did take us 6 months to come back to this, purely because both of us have been busy. I've been working and the client was working. So what I'm doing here now is putting in the camouflage pigment. Now, as you can see the pigment colour going in. And what you'll start seeing is little red furrow lines coming up. So straight after, you won't actually be able to see the colour going in. We've put a very diluted wash because I don't want to block the camouflage colour in. I want a nice wash, so it really is quite faint to begin with. So I'm showing, as you can see there, you can't actually see the colour. Well, what I mean is you can see the colour. As I'm wiping there, you can see the colour's gone in. But in a minute, you'll start seeing the redness coming up. And again, this has been fast forwarded because it would make the video far too long. I just wanted to come on and explain it. I'm hoping this is going to help you to understand the treatment a little bit more. So yeah, we're just putting all of the pigment in. I had to pause the video for a minute as the kids are in the background. So as you can see from the video, you can see the pigment on the top there, but when I wipe, the pigment is the colour that I want it to be. The client has got a slight suntan, so we put the colour in slightly lighter. It's better to go in lighter and be on the safe side than to go in too dark, which you can't then take away. I'd rather add to places. But from this side, there's a lot better lighting for you to be able to actually see it and see what we're actually putting in there. But you should be able to see by this point, if you look towards the other side, the little red marks that are starting to come up. So those little lines, obviously, were causing trauma to the skin. So you will be left with those little furrow lines that go across. But as you can see, the pigment is going in really nicely. I am going to do a video once this is healed in a couple of weeks, and I'll try and add it onto this video to update you. It's just I get a lot of questions about the stretch mark treatment and the camouflage treatment, and it all depends on what the client actually needs. Some people don't need the actual skin needling beforehand, and some people do because the stretch marks are too deep. And it is best to do that first before you do the camouflaging. So you can really see the difference it's making. Ideally, we do wait for the skin to heal after the skin needling and then get you to come back before 6 months, but it's just the way it worked out with this client, being able to get them back in. So this is just more of the treatment. I think you can see a little bit better this side because the light is much easier. We tried to get as many of the stretch marks as we can. I did purposely leave some around the side so we could kind of compare at the end of the treatment, but we can go back in and work on these as well. But the client was in minimal pain. Obviously, any tattooing procedure, you're going to have a little bit of pain. And with the skin needling, we can numb the skin. With camouflaging, we can't numb the skin because we want to be able to see where we're going. And numbing blanches the skin, which makes it white, which defeats the object. Really, you're going to be tattooing pigment into the white numbing area rather than where it needs to go. But she seemed pretty comfortable throughout. It wasn't an overly long process, and this is her towards the end. So you can see the lines there. We will update you once the client comes back to show you how this is all healed.